Hello, welcome. I'm Dr. Inman. This is another in the series of VOM-related disease conditions that we treat. This one is probably one of the most important ones, as it is in fact one that's dedicated to thoracolumbar disease, disc disease, and disc-related disease. This is the bread and butter of animal adjusting. Animal adjusting basically usually presents a clinical problem associated with a problem in the spine, either pain or lameness, or dysfunction of organ systems, whatever, all exists within the spinal cord. And of course, we found this to be the situation. This is one of the tenets of chiropractic care, quite frankly, and it's also a phenomenon that occurs in the spinal cord that is not recognized in the veterinary profession. In the veterinary profession, we have a tendency to take care of whatever problem that produces a symptom, and we treat the symptoms, but the primary problem actually occurs in the spinal cord. And the interesting and amazing thing about it is that we're able to utilize an instrument like this and flip a switch from the off side to the on side just by putting energy into the system. It's incredibly easy, as we show you in the series that we have on the index page or the home page of vomtech.com. I'll talk to you a little bit more about that later. Essentially, what we're talking about today is the treatment of disc and disc-related disease. Now, that includes virtually anything that occurs at the disc level. The so-called ruptured disc, proptosis disc, bulging disc, hurt or injured disc, acute back pain, acute spinal pain, essentially, Hansen type 1, Hansen type 2 discs, all the various types of disc phenomenons are all held in place and are caused by injury of some variety occurring in the spinal cord, but they're all held in place virtually by a phenomenon that is called vertebral subluxation complex. That subluxation complex is not a bone out of place, but rather it is in fact a phenomenon that occurs, a neurological interference that compromises the nerves at that level, turns them off essentially, causes them to be irritated, and also holds the problem in place. The interesting thing about it is that we can go through with a classic adjustment, and every time there is a switch that's flipped to the off side, we flip it to the on side. It's kind of important to understand that what we do when we do this technique is we're basically taking, just like a switch, and just flipping it to the on side. Now, if it's already on, it can't go any more on, and we can't flip it to the off side. So essentially, the philosophy behind the VOM technology is we go through, we check all the joints, and if in fact they give us a read or a reflexive pattern, it indicates there is in fact a facilitated neurological reflex associated with that area of subluxation complex. And if it's not, it's normal. That's not a problem. So we'll go through 3 passes, making sure that we flip every switch that's flipped off to the on side. The 3 passes that we show you on the vomtech.com website particularly are ones that are that we use day in and day out. We've used for the last 35 years. If you'll notice that the dorsal, so this spinal cord here, in this spinal cord of a canine, basically has a number of different areas that we can contact by coming in, going on the wings of the atlas, for instance, and then coming down the dorsal spinous processes, putting pressure into this spinal cord. Now, we can, with this device, deliver about 95 times as much power as the human being can. The human being can move manually about 80 millisecond pulse if they're fast, and deliver that to about a 1 pound of force per millisecond. However, an instrument like this moves at 1 millisecond instead of 80 milliseconds, so it's 80 times faster and delivers much more energy per unit time. The body of the animal is injured by motion, so we can't injure the animal if the amount of motion is a tiny little blip like this. But we can deliver a huge amount of force, and so we can go through and be relatively close to the area, delivering the energy from this instrument into the spinal cord, and we can find those switches and flip them back on. It isn't any more complicated than that. What we're going to do is we'll also show you that these animals that come in with back pain, and it's very common, just like you're sitting there with subluxation phenomenon occurring in your back right now. What we do is we can go in there, and since the dog is horizontal, or the animal is horizontal, we can come in there and we can actually reset virtually every vertebral segment. We start at the atlanto-occipital junction and move back to the spinal cord. What we're doing is we're kind of like unzipping or rezipping a zipper, essentially, and we go from the front to the back, front to the back, front to the back 3 times, and that usually confers that we have, in fact, found all of the neurological interferences and refresh them, or put them back online, if you will. This not only takes care of acute pain, but also allows the body to redirect healing into the area of the spinal cord that is compromised. For instance, when we talked about anterior cruciate ligament rupture repair, we explained to you that the body almost always has an L4-5 subluxation that occurs down here. Let me show you this on the canine, obviously the dog. And so the L4-5 area is about right here. And as we come down with our adjusting instrument, we get nothing, nothing, nothing. We get to L4-5, all of a sudden we get a panicculus-like reflex. Well, that means that that area of the spinal cord is inflamed, and it is also causing this internal rotation that's causing the knee problem that causes the anterior cruciate ligament. But that being said, there's subluxation problems all throughout, or subluxation complex problems throughout the spinal cord. And when we go through with this instrument, we can find them all and reset them all. In other words, we can maximize the circuit board that is in fact the spinal cord, and we can actually make it worthwhile. This, by the way, is the most common thing that we see routinely. Almost 70 to 80% of all of the conditions that we see when we find these reflexes in the animal's body are subclinical. And this is important because we can go through and find all kinds of reads in the canine, the feline, or the equine, and we can, in fact, put them back to normal even before they actually produce any disease process. A subluxation phenomenon or neurological interference will actually manifest itself sometimes for months to years before it can finally produce a clinical disease entity, such as a lameness or a back pain. And so it would appear to the client that the animal just got worse overnight. There must have been something that happened in their backyard because their nasty old neighbor shot them or something, when the fact of the matter is this problem can be on board for a long period of time. So when we routinely go through and check these animals, we'll find vertebral subluxation complexes or reads that we're able to repair and rehabilitate before the animal actually produces any disease process. It is this a process, the process of treating disc and disc-related disease conditions, thoracolumbar and vertebral problems in the cervical vertebra, that actually keep these animals alive and happy and living a long and happy and productive life. We can extend their longevity by about 30% when we keep them adjusted on a routine basis. So the classic adjusting technique that we show you on vomtech.com essentially is one that we do routinely in every animal that we see essentially, and the average age of our clients in our practice is about 3 years older than the average age of practices throughout the United States. Also, you might ask yourself, how could we possibly do this in the horse? Well, the fact of the matter is horse adjusting is even easier than dog and cat adjusting, because when we use this instrument, and we'll use it laterally in the neck, we show you that in the videos also that are on the vomtech.com website. We come down and contact the dorsal spinous processes of the vertebral segments. Remember, we use the bone as a conduit to transfer energy from this instrument into the actual nerve. This is not a bone technology, this is a joint technology based on, in fact, the nerves that are associated with the spinal cord. So what we're able to do with the horse, even easier than in the dog, is go through and easily and effectively optimize the functionality of all the spinal cords, removing lameness, back pain, lack of strength, lack of mobility, lack of coordination, and increased productivity essentially, and also the alacrity by which the animal moves, the efficiency by which the animal moves, its strength, and its speed too, for performance aspects. So we take care of lameness all the way up to performance enhancement of performance animals, dog, cat, and horse. Kitty cats, impossible to adjust manually. We can easily adjust them with this instrument because it fires at 1 millisecond. The body's reaction or response or resistance to motion is 20 milliseconds. So unless the animal wants to cooperate, you're not going to get it adjusted unless you use an instrument. The cat will not allow you to adjust it, and most dogs won't. However, interestingly enough, horses will. They will actually relax and let us motion their joints. So most of the manual adjustments, which we don't do, is done on horses. However, we don't have time to sweet talk the horse into cooperating, and most horses won't. So we use an instrument, and so they just stand there and lick their lips essentially as we adjust them. We show a lot more information on equine adjusting, which is very easy, very profitable, and self-generates in your practice on the course. In the course, vomtech.com website has that information for the course. We have over 6 different modules that we include in the actual course. Modules 1 through 6 are available on the vomtech.com website, which I'd have you check out. Essentially, we'll teach you how to do the technique, why it works, and also how to apply it in your practice. Also, the International Association of Veterinary Chiropractors we teach a course, and we taught it to over 8,300 graduate practitioners in the last 20 years. And we'd actually like to offer you the basis of this for free at that particular website so you can see how valuable it is, and then you can address the fact that we have a complete course that's about 400 or 500 hours of data essentially associated with all the various disease conditions that we see. Technique is incredibly easy to do. Anyone can do it. They can get the same kind of success that we have. However, we apply it to specific disease conditions. We apply it to laminitis in the horse. We apply it to paralysis in the dog and the cat. We apply it to endocrine disease and other somatovisceral disease in the kitty cat, for instance. So the point is that we have a huge body of information on treating most every disease condition using the efficacy of a non-surgical and non-medical approach, essentially. Its power and its ability to solve problems is immense and something that you should seriously consider in your practice. Thank you for taking the time to look at this particular video. They'll be playing more about specific disease conditions. As I mentioned to you before, thoracolumbar and spinal conditions involving the domestic animals is the bread and butter of animal adjusting, and essentially something that you're going to do virtually every day for the rest of your life in your practice. You'll be profitable, successful, and also professionally worthwhile. Thank you and have a great day.